Hey, this is Russ. Time to hear from another patient other than me. Yep. I asked you guys to send me information about your journey with the knee, and several of you have. And so I hope to try to put one of these out every week. And so there's plenty of spaces still. If you would like to let me know about your knee, just send me an email, okay? Send it to contact@russisright@gmail.com. It's all one word, contactrussisright@gmail.com. Don't send me spam, okay? If you're legitimately a knee patient, send me information about that. And send me a photo, too, because that kind of helps the video a little bit, so we can all see who you are. We don't want to see you. We want to see your knee, all right? Because we're going to keep everything confidential, right? So I'm not going to tell you who you are or anything like that. So I'll put another link up here. You can watch that video, which describes what we're planning to do. So today, we're going to be talking about another patient. We will call her patient number 2 from Kansas. Patient number 2 from Kansas. She is a 72-year-old woman, and she mentions that her husband helped her a lot in her knee journey. So I think that's actually an important thing. You have to have a support system. You can't really do this on your own, really. You need some help. So good. And she mentions too that she has gone through a lot of physical therapy. She had a jazz unit as well, joint active systems, just like me. And she's, of course, used a walker and used a cane. So she had her right hip done in April of 2019, and then her total knee replacement happened in October 29th of 2019. Okay. So she did mention something that I thought was interesting. Her knee is porcelain. It's not metal. I didn't know that. I didn't know that they had such a thing. But apparently she doesn't have metal. She has porcelain. But she did say that her knee was stuck for many weeks, and so she had some issues, and she had a scar release procedure. Now, she didn't say exactly what kind of scar release procedure she had, but she did have something done. She's still stiff today, and she still hobbles, she says. Okay. But her incision, which I'll show you here, okay, I'll show you a picture here. She says her incision was sewn closed from the inside and then super glued on the outside. Now, I think her knee looks pretty good. I think it's a lot better than mine. Mine's don't look that good. Okay, mine looks okay, but hers is better, all right? And then, of course, like many of us, she had a drain put in her leg to essentially drain off any fluids that are accumulated. I had that too, and actually, if you look at some of the photos in the past that I've put up, you'll see a little darkened dot on the side of my leg. That's from the drain. Okay. Here's an interesting thing about the drain. I don't know how they took it out for hers, but I recall the very next day, the doctor came to see me after the operation. I was still in the hospital, and he says, "How's everything going?" "Okay, yeah, it's time to take this drain out." And it's basically a hose that's actually attached to your leg. He just goes in there and rips it right out. I was thinking, shouldn't you close that hole up somehow or anything? Or am I going to be dripping things out of there? Didn't seem to bother him. He just ripped it right out of there. Nothing closed it up or anything like that. So anyways, okay, back to her, all right? Not enough for things about me, all right? She said that her bandage was infused with silver and left in there for 10 days, all right? And she mentioned that she's allergic to most pain meds, and so she rubs a CBD product, which has many essential oils 4 times per day. Now, CBD, if you don't know what that is cannabis, all right? Now, I was offered cannabis oil too. Jazz actually offered that to me, and I don't know if that helps or it doesn't. I'm sure it probably does, but I had a problem with that. I told them specifically, you might know that my background is in forensics, okay? I worked for several law enforcement agencies, and we used to put people in prison for cannabis. So I just had a hard time saying that, okay, I'm going to use the stuff now. That's just me, okay? I'm not telling you that you shouldn't do it, okay? I'm just saying that just because it's legalized now, I just can't get myself to do it. You know I don't like taking pain meds anyways, right? So so add that on top of it. Add cannabis, what is cannabis? Okay, that's marijuana. Right? Add that stuff to it. I couldn't do it. So yeah, so I refused it. Jazz says, okay, that's perfectly fine, is your choice. So they have some of that stuff available. She puts ice packs on her knee, and I think many of us do. I know I did for a long, long time. And okay, let's side note back to me. All right, we're talking about her. It's been past 14 months now for me, and my knee is still warm. Okay, it's not hot. I mean, in the past it would be like burning. Not, well, I wouldn't say burning hot, but it's quite warm because of the problems, right? So you have to put ice on it. Many of us have to put ice on it. I think I stopped putting the ice after about 6 months or so. But to this day, when I wake up or whenever I feel my knee, I'm feeling it right now, it is slightly warm to the touch. Now, I don't know whether you should continue putting ice on it or not, but I stopped after about 6 months. But it is still warm after 14. Something to think about. Oh, by the way, let me mention too, my incision. You might remember too that I had a darkening effect on the top of the scar. The bottom part of the scar didn't seem to do that, just the top did. And I mentioned that it was slowly getting less dark. I think it's actually getting even less dark now. So somebody had mentioned, I don't know where I saw it or heard it or whatever, that when that finally goes away, that means your knee is more healed. So maybe that means the knee is getting better. It is less hot now, and it's also less dark. Let's hope it finally goes away. I don't like that darkening effect on the top. Okay. She did mention that she had a lot of lack of sleep for months. I did too. I think many of us do. We have a problem sleeping. And a lot of times I think many of us have more pain sometimes in the evening. I mean, I couldn't lay down. I laid on a recliner chair for 3 months. So I don't know how she did it, but I don't think she did that. So, but she had lack of sleep. And she did mention something too that kind of feels bad for me. She was crying at home. And I recall being in physical therapy one time. There was an older woman there. And I recall when they were pushing on her leg, trying to get her knee to bend, I can see her softly crying. And that hurts. It just hurts me just to see that. So she's still not back to normal. She said that, will she have to do her other knee? She hopes not, but she says she does enjoy that there's no bone against bone right now for her. So that is her story. And hopefully, she'll continue to update us as she gets better over time. So anyways, if you enjoy these type of stories and you want to share with us your journey, send me that email, okay? Because I think a lot of us can benefit just hearing from others. And it could be a good journey or something you're struggling with. Just let me know, and we'll keep it private as far as information. I'll just give the same information, just like what you heard now. We'll just identify you with a patient number. She is patient number 2 from Kansas, female, okay, 72 years old, and that's all we'll basically tell people. All right. So I hope to try to do this once a week, and I know I have another one coming up the following week, so you got to watch that. I don't want to do these, several in a week. We'll do one per week, all right? But as your journey changes, update me, and then we'll update the other people too, so everyone knows how everyone's doing, okay? Hey, if you like the video, hit that like button, hit the subscribe button, and I will talk to you guys next time.